what age do you see people coming in for that? I know that you can't treat the age, but are you seeing, is it trending younger and younger because people are starting to move away from these less invasive things and just wanting to go? Like, I know for myself, that's me. I'm like, I just want to have the surgery. Give me a brow lift so that then I'm not doing like all the other things. I mean, Botox is an easy solution if it's just a minimal lift and kind of opening of that area that you want to get. But I did get a brow lift 7 years ago because I had very hooded eyes. And I mean, I did fat transfer in 2021 because I was
Okay.
like, I lost a lot of volume genetically. I had kind of a narrow, long face. And so we did that. And I'm like, okay, done. Like, I want to do it and then not think about
Right.
it.
I definitely think we're seeing that more now with patients coming in at a younger age, coming in for something that's more longer lasting and truly addresses the problem. So I think when people are trying to get a lift with filler or um, other devices, they're not really treating the underlying issue, which is descent of the internal soft tissue, which is what a deep plane addresses. So it addresses the SMAS layer, which is the layer underneath the skin that loses volume and drops with time. And so, unless you're actually relifting that back into position, everything else is really camouflaging. And so, I think there's a bigger group now of patients that I think are more educated, that really understand that concept more. So, we are definitely seeing surgery and facelifting and facial rejuvenation at an earlier age. And I think it's great because I think it really addresses a problem. I think it looks more natural. It definitely lasts longer. And I think that when you do smaller procedures earlier, it helps to prevent larger procedures down the road.
Yeah. And I was going to say, it's probably kind of more undetectable. If you're going in, you're getting a facelift at 40, just to give an easy example, then you're setting the clock back a little bit. And then when you're 50, you're not going to, it's like some people wait and they don't do anything and then they go in, I would imagine at like 70 to get a facelift. And then it's very obvious. Whereas if you're doing like these subtle tweaks over time, you're just kind of like aging very gracefully.
Yep. I think that's really the key. And I think we're seeing a lot of that earlier. And what that leads to is not only rejuvenation with a smaller procedure, but you're able to keep the incisions shorter and less noticeable and less perceptible. And there's also less of a difference between the before and after so that it's a subtle improvement as opposed to, like you said, if you're waiting till you're 60 or 70, the change is going to be much more drastic and much more noticeable.
Yeah, you wanna get that surgery where people are like, "You look really rested." Like, that's
Right,
the goal, right?
exactly.
Like, they don't know, they can't quite put their finger on it. That's you don't wanna look like you've had surgery,
Right, exactly.
basically. What are some underrated procedures that maybe people are not as aware of?
So I will say I'm pretty impressed with how social media has really driven a lot of education and awareness to different types of procedures. Um, I think one of them, an underrated procedure, would be a chin implant. It's something I would say that less than 2% of my patients who have chin implants or who have suggested chin implants for have come in asking for it. But I would say 100% of my patients that do a chin implant after we've assessed their face love it. So I think it's one of these things that we really don't see our profile. So it's really helpful when you have a plastic surgeon evaluating your face and looking at facial balance and facial symmetry to assess you from their profile. And that's something that I think makes a huge difference, even when it's a really small chin implant.
Am I a candidate?
I'd have to look at you from the side, but you look pretty great.
Because I've wanted one. My girlfriend got one, and it was like she's gorgeous to begin with. I'm like, "You're crazy. What do you don't need a chin implant." She had like a perfect kind of heart-shaped face, and she got it, and it was like game changer. I mean, it really just balanced everything, elongated, like in a really beautiful way. Um, yeah, mine is like short, I feel.
Yours
She's
looks okay to me.
really?
Yeah.
Not like a small flowers? Just
No, it looks okay to me.
okay.
One thing I think if you take a photo from the side and you kind of adjust the chin, you can really see the power of the chin. So if you make it slightly weaker, you really see how that affects the face. And I do a custom chin, and I don't mean like taking a out of the box and whittling on the table. I actually have patients get a CAT scan. I render that into a 3D image, and then I design the chin implant onto the 3D skull. It then gets printed, sterilized, and shipped to me for the patient. So I really customize it to the face. And especially for women who have a more refined lower face and delicate lower face than men, I think custom is really important because it allows you to keep that feminine shape.
Yeah, because I have a little bit of a longer chin, so I was always worried that if I did I want it for projection. We're turning this into my consult now. But I was, like, worried that from the front, then that would, like, elongate the
So there's different ways you can do
okay,
it. And so
great.
you can either just do straight projection, so in the X axis, or you can do elongation or lengthening. But you don't have to do both. So with a chin implant, you could just do straight projection
This is
without
great
elongating the
news.
chin.
Great news for me. What about jaw implants? Are people doing that? I feel like there's some celebrities recently that look like they may have done that.
So, jaw implants are something I do. I also customize that. And what that does is it changes the shape of the angle of the jaw. And you can do that by elongating, so lengthening what's called the ramus, which is the vertical length of the jaw. And then you can also change the angle. So, how sharp it is, how wide it comes out or flares. And that will really change the jawline. And I would say that's more common in men than women, but you can do it for both.
What are celebrities doing right now, if you can say? Like, what are the procedures? I mean, just from looking at people, it looks like definitely facelifts, younger, rhinoplasty, probably bluffs, like these things that really refine, but in a subtle way. But is there anything that's like trending?
I would say the trending aspect is more starting early. So I think that a lot of celebrities are starting in their 20s and 30s or 40s. And these minor surgical changes look so natural that a lot of people think it's just, aging gracefully, or that it's non-surgical procedures. But I think, that's what we were talking about earlier with these key, very small subtle enhancements. We're seeing that with eyelids, faceless neck lifts. Again, chin implants is definitely something that I think a lot of people don't recognize that a lot of people have. Um, and then I think skincare. I think that's really important. So lasers, and then making sure they're really both protecting the skin with sunblock and then using retinols and other sorts of um, ingredients like antioxidants to really help the skin.